Give me just 1 second. Okay, perfect. Okay, so I believe I have some information, but it's not complete. So we're going to have you answer more questions in regards to your health. But first, can I please verify your first and last name? Okay. Good. And your date of birth? Okay, great. Is your address still the same? Good. Okay. And your phone number? Perfect. And you said you're in general good health. Okay, that's good. And you're around 30 years old. Okay, great. Okay, can you please tell me today's date? Perfect. And let's see. Have you had any serious injuries in the last 12 months? No. Do you remember having thyroid disease? No. Did you have any surgeries? You did, okay. And what kind of surgery was that? Okay. So you had an appendectomy 8 months ago. And how did that heal? Okay, good. So no complications. Perfect. Can you please tell me at what hospital you had that surgery done? Okay. And do you remember who the surgeon was? Okay. Okay, do you have history of COPD or asthma? You do? Okay. And are you taking any inhalers? You are. 2. Okay. What's the first one? Epinephrine, okay. What's the dosage? And how often do you take it? Okay. And the second inhaler? Okay. Good. And the dosage for that, do you remember? You don't remember? That's okay, I'm gonna look it up. Okay. Let's see. Have you ever had blood pressure medication prescribed? No? Okay. Do you have any allergies? Okay. So you're allergic to shellfish. Okay. Nothing else. That's good. I think I have everything that I need. Go ahead and I'm going to take your vital signs first. So I'm going to take your temperature first. This is going to go underneath the tongue, so go ahead. Just open your mouth. Okay, good. Okay, so 98.6, that's perfect. Next, I'm going to put this on your finger, and it's going to measure how much oxygen is going through your body. Also, we're going to take your heart rate. Okay, so just on your finger. Okay. Just let it be for a little bit. Relax. Okay. Okay. So your oxygenation is 99%, which is great. You want it to be above 92%, which means that, your lungs are breathing very well. And your heart rate is not that high either, so that's very good. Okay, let's go ahead. I'm going to measure your blood pressure now. Is the right arm okay? Okay, good. Okay. So just try to relax. So your blood pressure is normal, 98 with 60, so that's very good. And let's go ahead. Okay. I'm going to listen to your heart. So I'm just going to need you to relax. The stethoscope is right here where your heart is, and I'm just going to very slowly listen. Just want to make sure that you don't have any heart rhythm abnormalities. Okay. 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 Okay, perfect. So I could hear S1 and S2 only, no S3, no S4, which is very reassuring. And I'm going to listen to your heart now with the bell. I'm looking for any murmurs, which would indicate more like valve problems. So far everything sounds great. Okay, now I'm going to listen to your lungs, so I'm going to ask you to take a deep breath in and relax. Good. Take a deep breath in and exhale. Good. Take a deep breath in and breathe out. Okay, take a deep breath in and relax. Okay, take a deep breath in and exhale. Take a deep breath in and breathe out. Perfect. Okay, so no signs of pneumonia either, which is very good. And now we're gonna go ahead. I'll check your facial sensation first, if that's okay. Okay. So I'm just going to tap on your face. I don't know if you feel that. Good. Do you feel that? 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 Okay, perfect. Now I'm going to touch your ears. Let me know if you feel. You did? Good. One more time. If you feel it. Okay. Now I'm going to check your scalp and your head for any lumps or bumps or infestation. So that's why I have the gloves. Let me know if you feel any kind of pain. Okay. But so far, from what I can tell, your head is symmetric. Your skin is well perfused. I don't see any signs of cyanosis. And that's a very good sign. And from far away, I can't see any signs of infestation, but I'll come a little bit closer. Okay, and I'm just going to take a look. Okay. 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 Nothing. Good. Okay. Okay. And I'm gonna ask you to just look a little bit this way. Okay, good. And that way. Alright. So I'm going to check with the comb. Okay. So I'm just going to brush. Okay, brush. Okay, so no signs of infestation, and I'm just going to take a look a little bit closer with a better light. Okay. Okay, everything looks good. I'm going to touch your face. Let me know if you feel this. Feel that? Good. Do you feel that? Good. Do you feel that? Okay. Do you feel that? Good. Do you feel that? Okay. And do you feel that? Perfect. Okay. Now I'm going to touch touch your face with something a little bit more sharp, so let me know if it feels different. Do you feel it? Okay. Okay. Was that sharp or dull? Sharp. Okay. What about now? Sharp or dull? Sharp. Okay. Very good. Okay. So I'm going to check your mouth. I'm going to have you open your mouth as wide as you can. Okay. I don't see any signs of cavities, no lumps. Color is normal. Okay, perfect. No signs of inflammation either. Can you please stick your tongue out? Good. Move it up and down, left, right, perfect. Now can you please smile for me? Okay. Frown. Good. Puff your cheeks. Okay, perfect. And go ahead, shrug your shoulders. Good. Okay, we're gonna do a quick exercise. So I'm gonna ask you to use only your right hand, okay? And put your finger like this. Very good. So now what I need you to do is to touch your nose and then touch my hand. Okay? So we're gonna do that for a few seconds. Let's see how you're doing, okay? So just go ahead. Touch your nose and then touch my hand. Good. Touch your nose, now touch my hand. Good. Touch your nose, touch my hand. Okay. Now I'm gonna do a little bit more complicated. I'm gonna ask you to do the same thing, but touch my finger. Okay? Okay, good. So go ahead, touch your nose, touch my finger. Good. Touch your nose, touch my finger. Good. Touch your nose, good. Touch my finger. Okay. Touch your nose, touch my finger. Good. Touch your nose, touch my finger. Good. Touch your nose, touch my finger. Okay. Touch your nose, touch my finger. Okay, very good. Let's go ahead and switch. So same thing. Touch your nose and then touch my palm. Okay, good. Okay, good. 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 And now we're going to, increase the level. So I'm going to ask you to touch my finger now, okay? So touch your nose, touch my finger. Good. 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 Touch your nose, touch my finger. Okay, perfect. You did very well. Okay, I would like to check your reflexes. So this is going to check the reflexes on your face, and then I'm going to move down the body. Okay, so let me know. Okay, perfect. You felt that. Good. One more time. Let me know. Okay, so no pain. Good. One more time. Okay. Yeah, I'm trying to go only on the bony prominences. Good. Good. Okay, good. Now I'm going to move down to the shoulders. Good. Good. And I'm going to go down the elbows. Okay. Now I'm going to go right here on your wrist. Perfect. Okay. Go ahead. We're going to check your nose. Okay. I'm going to ask you to look up for me. Okay. Notovagus septum. Mucosa is intact. No abnormalities there. Okay, very good. Both nares. Now, what I'm going to need you to do is to press on one nair, okay? And just breathe in, breathe out. Good. I'm going to do the same thing. Press on the opposite nair and just breathe in, breathe out. Okay, good. Now, let's go ahead. I'm going to cover the nair again. Can you please smell this and identify the smell? Great. Okay, I have one more. Now cover your other nostril. Okay, good. Can you smell that? Okay, perfect. Alright, now I'm going to check your taste buds. So I want to see if, your nerves are intact. So I'm just going to put one drop on your tongue, and please identify the taste. Okay, so just one drop. Good. What does it taste like? Okay, so what I'm going to do now is I'm going to check your skin for any lesions. I'm going to take a look at your moles. I'm going to start with your face and I'm going to move down the arms. Is that okay? Okay. 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 Good. And now I'm going to look at the neck. Okay. Okay. Perfect. Now I'm going to move down on the arms. Okay. Looks good. I don't see any abnormalities. And now I'm going to look this way on your other arm. Okay. Okay. Okay, good. Perfect. Okay. Perfect. 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 Okay. And would you like me to look on your chest a little bit too? Okay. Okay, good. Good. Perfect. Okay. Now I'm going to have you follow the light. You see this light right over here? Okay. So just look at the light and follow it with your eyes only. Don't move your head at all, okay? Good. Okay. I'm going to check your pupils, so just gonna need you to look straight at me. Good. Same thing, look straight at me. Okay, so pupils are round and reactive to light. Now, let's go ahead. I'm going to check your ocular nerve. So I'm going to bring this a little bit closer. Okay. Good. Good. Your ocular nerve is intact. I don't see any abnormalities. I'm going to look in your other eye now, so just trying to find your eye right here. Perfect. So I'm just going to bring this a little bit closer, 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 closer. Okay, looks good. Alrighty. Perfect. The optic disc is intact. No nerve abnormalities either. Okay. Now, I would like to take a look inside your ears, if that's okay. Okay. So we're going to start with your right ear. Looks good so far. So the tympanic membrane is intact. I'm not seeing any lesions or abnormalities and no excess earwax either, so that's good. Now I'm going to have you look that way and I'm going to check your left ear. Okay, I do see a little bit of redness, but nothing to worry. Maybe you just scratched the inside of your ear canal. Tympanic membrane is intact, pearly gray. Okay, and everything looks pink and healthy. Great. Okay, so I do have your inhaler right here, and I'm gonna ask you to show me how you do it. I just want to make sure that you're doing it properly and then you're all set. Okay? Okay, so first I'm going to show you how to do it and then you do it. Does that sound okay? Okay. Okay, so the medication is already in. Okay, if you want to change it, all you have to do is just take it out, throw it in the garbage, place a new one in, and you have to screw it in. Okay, so now we know it's in, and you just open a cap, just like that, and then you put your mouth around this area right here, and you try to create a seal. Okay, and by creating that seal, you make sure that you take all the medication, and once you have this piece inside your mouth fully and it's sealed with your lips, then you can press on the inhaler and take a deep breath in and hold it in for 3 seconds, and then you can breathe out. Okay, so go ahead. I'll have you show me now. Okay, perfect. Very good. Good. Just like a pro. Okay, I wasn't expecting anything else. I was sure that you're doing it very correctly. And thank you so much for demonstrating that to me. Okay. Just going to complete my documentation and you're all set. Everything looks very healthy. I love that. I'm gonna ask you to come back next year. Would you like that? Okay. Great. Love it. It was very nice to meet you. Have a wonderful day. Thank you.